Hello and welcome for a webinar on the series of anatomy revision. And today we have chosen a topic on the demand from the students, and that is the study of triangles of neck. Actually, we have covered the full portion on anatomy syllabus of both paper 1 and paper 2, but some students wanted to have a revision on the triangles of neck. So that is why I have chosen this topic, and I welcome you all for this webinar. How the triangles of necks are formed. This is just like plotting of the land, the land is plotted into guntas and all that. You know that एक गुंठ्याचा plot, दोन गुंठ्याचा plot, likewise. So the neck is divided into triangles because the side of the neck is roughly quadrangular. तो एक चौक आहे बघा, असं चौक आहे आणि त्याचे triangles निर्माण केले with the help of muscles and imaginary lines, midline and all that. So the triangles of the neck is roughly quadrangular shape of the side of the neck is divided to get those triangles. So it is bounded anteriorly by anterior midline. I am talking about the quadrangular, side of the neck, anterior midline, posteriorly by the anterior border of trapezius muscle, and superiorly by the lower border of the body of mandible, and in line from the angle of mandible to the mastoid process, because that is a little space remaining there, and inferiorly by the superior border of the clavicle. So this becomes a quadrangle here on one side. So there is another quadrangle on other side. So these are the two quadrangles. Now each of this quadrangular area is further divided into sub triangles. And the first is the quadrangular area on one side is diagonally divided by the sternocleidomastoid muscle into large anterior and comparatively small posterior triangle. So the side of the neck is now divided into anterior triangle and posterior triangle. So on this side also, on that side also. Now apart from these two large triangles on the side of the neck, there is one suboccipital triangle situated deep in the suboccipital region of the neck, on the back of the neck, on each side of the posterior midline. So this suboccipital triangle is not part of either the anterior triangle or the posterior triangle. There is a different triangle which is present only on the back of neck, and that is one on each side of the midline. Okay, let us proceed further. The triangles of the neck, in all, when we actually answer for the triangles of the neck, we answer only about anterior triangle and posterior triangle. But I told you there is one more triangle on the back side, and that is suboccipital triangle. So actually there are three triangles on one side and three triangles on other side. So remember this, otherwise what happens, you will miss out this important triangle, and this triangle is called as suboccipital triangle. A short note can be asked on suboccipital triangle as well. Now main triangles of the neck are anterior triangle, posterior triangle, and suboccipital triangle. So they are present on the both the sides of the neck. I think this is clear now. Now let us today have a small study of suboccipital triangle. The suboccipital triangle is formed by the muscles, and that details we will have on this slide. The suboccipital muscles are a group of muscles defined by their location in the occiput form suboccipital triangle. Okay, so location to the occiput form suboccipital triangle. So these muscles actually form this suboccipital triangle. The suboccipital muscles are located below the occipital bone, so they are called as suboccipital muscles. And these are four paired muscles on the under side of the occipital bone. The two straight muscles are called as rectus, so recti, and the two oblique muscles are called as obliquus or obliqui. So two recti and two obliqui. We are talking about these muscles. The suboccipital muscles are named as rectus capitis posterior major, which goes from the spinous process of the axis vertebra to the occipital bone. Another is rectus capitis posterior minor, which goes from the midline of the posterior arch of the atlas to the occiput. Another is obliquus capitis superioris, which goes from the transverse process of the atlas to the occiput. Another is obliquus capitis inferioris, which goes from the spine of the axis vertebra to the transverse process of the atlas. They are all innervated by the suboccipital nerve. So remember this 1, 2, 3, 4 muscles, 2 recti and 2 obliqui. And here is your suboccipital triangle on one side. See how beautiful it looks. So this is neither an anterior triangle nor a posterior triangle. This is a different triangle, differently located on the back of the neck, and this is called as suboccipital triangle. You can see 1, 2, and 3 muscles. 2 muscles are together here. Okay, above. So one is rectus capitis posterior major. So this blue one. Now green one is obliquus capitis superior or superioris, and red one is obliquus capitis inferioris. So these two recti are together. Okay, and this is the space between these 3 muscles, which is giving you the form of one triangle, and this triangle is called as suboccipital triangle. When I was in first year, I remember there was a short note on suboccipital triangle, and that was in the year 1986. Okay. Now suboccipital triangles on both the sides, if you see, they look like this. Even 1, 2, 3 boundaries making one triangle on this side, one triangle on that side. So here you can see suboccipital triangle on the back of the neck on one side, which is very clear. You can see here. Okay. These diagrams are very important for us to understand. That is why always take help of these diagrams. It is a triangular muscular space on the back of neck bounded by the following 3 muscles of the suboccipital muscles. So we saw those 4 muscles. Out of those, these 3 main muscles take part in formation of 3 boundaries of the triangle. Rectus capitis posterior major, above and medially. Obliquus capitis superioris, above and laterally. Obliquus capitis inferioris, below and laterally. So the floor is formed by the posterior atlanto-occipital membrane. So between atlas and occipital bone, there is a membrane. So that forms the floor of this triangle, and the posterior arch of the atlas also. In the deep groove on the upper surface of the posterior arch of the atlas are the vertebral artery and the first cervical or suboccipital nerve. So the contents we are talking about: vertebral artery and suboccipital nerve. Okay, yeah. Here you can see the triangle, and here you can see the vertebral, okay, artery. The color is here. The color used is for the vein. So you can see the vein, internal jugular, which is pouring. Vertebral vein is going downwards. You can see that located in the triangle. Okay. The suboccipital triangle contains, if we call, remember these 4 structures. One is third part of vertebral artery. So vertebral artery is going inside the cranial cavity to unite, both the arteries unite to form a basilar artery, and basilar artery takes part in formation of circle of Willis for the supply blood to the brain. So it is entering through the foramen magnum. So before entry, we see a third part of vertebral artery. Greater occipital nerve is another content. Suboccipital plexus of veins also you see, and suboccipital nerve. So 2 nerve, 1 artery, and venous plexus. Okay. Now what is the applied anatomy or the clinical significance of this suboccipital triangle? It is usually is mainly for the purpose of surgery, surgical, what you call interventions. One is cisternal puncture. Cisterna, we have cisterna means pools of CSF inside the cranial cavity, and you want to puncture it for the purpose of aspiration of CSF. So this triangle is chosen to enter into the cranial cavity to puncture a cisterna. The main or important cisterna is cisterna pontis, which is present just below the pons. So there you can go through this triangle. Another is carbuncles of neck. Carbuncles of neck means big boils. Big boils म्हणजे मोठे मोठे फोड उठतात मानेच्या मागे. So they may carry infection to the intracranial area, and the brain will get infected. For that purpose, this location is very important. Now we'll try to understand anterior triangle of neck. Okay, so this is a common triangle and quite commonly asked in exams. So the triangles of the neck are an anatomical divisions created by the muscles of the head and neck. It is used clinically to locate structures that pass through the neck. So why the triangles are necessary? So that we can locate the specific structures. So for example, if you want to talk about carotid artery, we can say the carotid arteries are located in the carotid triangle. So once you know the carotid triangle, it goes very easy to identify the carotid structures. That is why. This is the clinical significance. Okay. So in this region, there are two major triangles which are separated by the sternocleidomastoid, and these are anterior and posterior triangle. So this muscle diagonally passes from mastoid process, passes from below upwards. So passes from sternum to mastoid. Plus also it takes a clido, means clavicular head. It has got two heads, sternocleido and mastoid. Two heads of origin and one head of insertion. So that muscle divides your side of neck into two triangles. So it is important to note that all triangles mentioned here are paired. So every triangle is paired. They are present on left and the right side of the neck also. Here you can see the side of neck, and you can see the boundaries of the quadrangle. From here, if you go from the base of the mandible to the angle, from angle of mandible to the mastoid process, this becomes the superior, border of the quadrangle. Posterior one is anterior border of the trapezius. Inferior border is upper border of the clavicle and anterior midline. This becomes a quadrangle, and this quadrangle diagonally divided by the sternocleidomastoid muscle. Then we will have an anterior triangle in front of it and posterior triangle behind it. Okay. So anterior triangle is situated at the front of the neck, bounded by superiorly by the inferior border of the mandible, that is lower jawbone, and laterally by the medial border of the sternocleidomastoid muscle, and medially by the imaginary sagittal line, sagittal line, or also called as midline of the body. It can be subdivided into four further triangles. Anterior triangle is divided into four triangles by the hyoid bone, just above the, just in between the thyroid cartilage and the chin. Okay, between. So there is a hyoid bone into suprahead, and by the hyoid bone, suprahead and infrahead muscles. There are group of suprahead muscles, infrahead muscle. Sub triangles are named as, one is carotid, other is submental, third is submandibular. Submandibular triangle is also called as digastric, and the last is muscular. Remember all these four triangles. There can be a full question on anti-triangle. There can be a short note on one of these, triangles, carotid triangle, muscular triangle. So everything is important for exams. That is why we have chosen this topic. Here you can see the red line showing you the limits of anterior triangle of the neck. So this is the superior border, this is the anterior border, and this is the posterior, lateral border. Okay, lateral or posterior. Call it lateral. So apex is directed downwards and the base is directed upwards. So this becomes base also. Now this triangle is divided by this hyoid bone and these different suprahead and infrahead muscles. Okay, and behind the sternocleidomastoid muscle there is a small triangle. Here you can see this is a posterior triangle. The apex of posterior triangle is directed upwards, opposite of this, and the base is directed downwards. Okay. Now anterior triangle, first subtriangle is carotid triangle. The boundaries are superiorly posterior belly of digastric muscle, laterally medial border of the sternocleidomastoid muscle, inferiorly superior belly of omoid muscle, and The main contents of the carotid triangles are the common carotid artery. Okay, the common carotid artery on the left side it comes from the arch of aorta, on the right side it's a branch of brachiocephalic trunk. And this artery, when it comes to the carotid triangle, it bifurcates, means gets divided within the carotid triangle into the external carotid artery and internal carotid artery. So ECA and ICA. ECA means external carotid artery. It has got 9 branches. That becomes a full question again. And internal carotid artery enters through the carotid canal into the cranial cavity to form circle of Willis with with those vertebral arteries, and we uniting to form a basilar artery. The internal jugular vein is another content, and the hypoglossal and vagus nerves are also found in this triangle while traversing further. So here you can see the what you call carotid triangle. So the red, always remember the red borders are for this demonstration. Carotid triangle. Then this becomes superior border, anterior border, and the lateral border. So you can see the omohyoid superior belly here. This is omohyoid inferior belly. Omohyoid, omo means scapula. Hyoid bone is here. So it's a very long muscle, long and slender muscle. Okay. And another triangle is submental triangle. Submental means just below the mandible. It is situated under the chin. Okay. Mentum. Its main content is this submental lymph nodes, which filter lymph draining from the floor of the mouth and parts of the tongue. So whatever the lymph which is drained from the floor of the mouth and tongue is drained by these submental lymph nodes there. So infection of the tongue or just below the tongue, if you get ulcer, you will get a pain over here. That shows that lymphadenitis caused due to infection in the floor of the mouth. Now the boundaries of this triangle. Inferiorly, submental triangle is bounded by hyoid bone. Medially by the imaginary sagittal midline of the neck. Laterally by the anterior belly of the digastric muscle. So digastric means double belly. So it's called anterior belly and posterior belly. The base of the submandibular triangle is formed by the mylohyoid muscle, which runs from the mandible to the hyoid bone. So myelo means mandible, hyoid means hyoid bone. So this is the floor, mylohyoid muscle. Here you can see in this diagram, the triangle which we are talking about is submental triangle. You can see here, the apex is towards the chin. So we are taking on one side, we're talking on one side, and there is another triangle on this side. So here the base, you can see the base is formed by the hyoid bone, and here you can see this anterior border and the posterior border. On the floor there is a mylohyoid muscle. Okay. And now next triangle is submandibular triangle, that's also called as digastric. This is located underneath the body of the mandible. So that was under the chin, submental. This is under the body of the mandible. It contains the submandibular gland. So there are three pairs of major salivary glands. One of them is this submandibular gland, and the submandibular lymph nodes also. The facial artery and vein also passes through this area. So the boundaries of this this submandibular triangle are superiorly bounded by the body of mandible, anterior by the anterior belly of digastric, and posterior by the posterior belly of the digastric. So both the bellies of digastric take part in formation of the triangle. That is why this triangle is also called as digastric, and it is just below the mandible, so it is also called as mandibular triangle. Plus it contains the mandibular salivary gland, submandibular salivary gland, so it is also called as submandibular triangle. You can see here mandible, just below the mandible, this triangle, you can see submandibular triangle. Okay, anterior belly of digastric, posterior belly of digastric, and the base of body of mandible. Here, the muscular triangle, last triangle in the anterior triangle of the neck. This anatomical area is situated more inferiorly than the triangular subdivisions. It is a slightly dubious triangle. In reality, having 4 boundaries. Actually, this triangle is not more quadrangular type. Okay, it has got actually 4 boundaries, but we are assuming making it a triangle for the purpose of understanding. The muscular triangle is also unique in containing no vessels of node. So it doesn't contain any vessel. It doesn't, however, it doesn't contain anything else other than some muscles and organs, the infrahyoid muscles, the pharynx and the thyroid and parathyroid glands. It contains contents of this muscular triangle. Because content it has got muscles in it, so it is called as muscular triangle. So contains infrahyoid muscles. The boundaries are superiorly the hyoid bone, medially imaginary midline of the neck, superior laterally superior belly of humoid, and inferior laterally inferior portion of the sternocleidomastoid muscle. Here you can see the muscular triangle. If you see at above, it is not triangle but it is a quadrangle. सो ही जी बाउंड्री आहे ती डायरेक्ट एकदम भेटत नाही, तर ती काय होते, अशी होते. त्यामुळे हे ना द ट्रायंगल आहे ना द क्वाड्रँगल, हा थोडासा ट्रपेझॉइड शेप आहे बघा. So you can mention this sentence in the answer. I remember muscular triangle was asked many times in exams. So you can see all these boundaries. So here you can see here the base and this boundary we have to consider as one. So, Anterior triangle gives us some clinical anatomical knowledge, because the carotid sinus syndrome and the carotid arteries are located in the carotid triangle. Pulsation of common carotid arteries can be felt in the carotid triangle, which is a part of anterior triangle. Swelling of the submandibular swelling in the submandibular triangle also gives us some clinical significance. For example, submandibular gland gets swollen, and also submandibular lymph nodes get swollen. So lymphadenitis, what we call. Now, posterior triangle of the last part. The posterior triangle of the neck is also known as the lateral cervical region. Okay, the borders are posterior border of the sternocleidomastoid muscle, posteriorly anterior border of the trapezius muscle, inferiorly middle 1/3 of the clavicle, and the roof is formed by the investing layer of the fascia. This is the deep fascia, one of the layers of the deep fascia of the neck, cervical fascia, what we call. The floor is formed by the prevertebral fascia. So there are facial layers of the neck. That can become another question. So here you can see the red margins which are showing you the posterior triangle of the neck. So here it becomes anterior border. Posterior border of sternocleidomastoid muscle becomes anterior boundary of posterior triangle. Similarly, anterior boundary of trapezius becomes posterior boundary of border of trapezius becomes posterior boundary of posterior triangle, and middle 1/3 of clavicle becomes the base, and apex is pointed towards the mastoid process. And muscles which make up the borders and floor of this area, let's try to understand this. A significant muscle in the posterior triangle is the omohyoid. I told you omohyoid means going from scapula to hyoid. So that means omo is for the other name of the scapula. It is split into two bellies. So it is going up in the terms of two bellies by a, so there is a tendon in between. It's called intertendinous. In between the two bellies there is a tendon. The inferior belly crosses the posterior triangle and traveling in the superomedial direction and splitting the triangle in two. So inferior belly of the omohyoid divides the posterior triangle into two subtriangles. So here we have only two subtriangles. Vertebral muscles covered by the prevertebral fascia form the floor of the posterior triangle, and spinous capitis, levator scapulae, anterior, middle, and posterior scalene muscles are the vertebral muscles found there in the floor. A vasculature means external jugular vein is one of the major veins of the neck of regions formed by the retromandibular and posterior auricular veins, and transverse cervical and suprascapular veins also lie in the posterior triangle. The subcranian, the transverse cervical and suprascapular veins are accompanied by the respective arteries in the posterior triangle. The distal part of the subcranial artery can be located as it emerges between the anterior and middle scalene muscle. So the scalene muscles are also called as anterior scalenus muscle or scalenus medius muscle. Okay, as it crosses the first rib, it becomes the axillary artery. The subclavian artery, when it crosses the first rib, it becomes axillary artery. You know that. So subclavian artery, axillary artery. The axillary artery continues further as a brachial artery, which goes on to supply the upper limb. So nerves means nerves which are found in posterior triangle are the accessory nerve, that is 11th cranial nerve, which exits the cranial cavity and descends down the neck, innervates the sternocleidomastoid muscle and enters the posterior triangle of the neck. The cervical plexus forms within the muscles of the floor of the posterior triangle. Other branches of cervical plexus innervate this vertebral muscles. So above the brachial plexus, there is a cervical plexus. The trunks of the brachial plexus also cross the floor of the posterior triangle. So you have to mention about the trunks of the brachial plexus which cross the floor of the posterior triangle as it's contained. Now what are the subdivisions? The inferior belly of the omoid muscle splits the posterior triangle of the neck into two. I told you that. The larger superior part is termed as the occipital triangle, and the smaller inferior part is called as the subclavian triangle. So we have got two triangles here, occipital triangle and subclavian triangle. Now just try to remember about that suboccipital triangle. Don't get confused with suboccipital triangle and occipital triangle. Occipital triangle is a subdivision of posterior triangle, whereas suboccipital triangle is an independent triangle away from the quadrangular space of the side of the neck. The larger superior part is termed as the occipital triangle and contains occipital artery mainly. It is called occipital triangle because it contains occipital artery, which is a branch of external cavitary artery. The inferior triangle is also known as subclavian triangle. Subclavian means below the clavicle, and it contains the distal portion of the subclavian artery mainly. Here you can see the posterior triangle. Here you can see the division of posterior triangle. This blue color, light blue color muscle is a inferior belly of omoid. So above it, bigger area is called as a occipital triangle, and below a smaller area is called as a subclavian triangle. And you can see the names of these muscles: spinous capitis, the levator scapulae, middle scalene or scalenus medius, and posterior scalene or posterior scalenus posterior, and scalenus anterior, anterior scalene. These are the muscles. And posterior triangle applandomy, if you want to know more about that, swelling in the posterior triangle and brachial plexus block and pulsations of the cervical artery are felt in this area. If you have any questions, you can ask me. Otherwise, we are already at the end of today's session and time limit. If you have any questions, I'll wait for some time. And with this, we end today's webinar. Thank you all for patiently listening to me. And have a nice day. We'll come back tomorrow with another topic. Any question?
Sir?
Thank you. Okay, thank you.